Okay, hormone replacement, everything that you need to know about this. First of all, you need to know the body was designed to maintain hormonal balance for a lifetime. And many women sail through menopause with nary a symptom. They just notice, oh, no more periods. I won't ask you to raise your hand if that's happened to you. And then some need outside help, some more than others, and thankfully more options are available than ever before. So I want to tell you what happens normally. This is called Menopause 101, all right? We'll make it quick, it won't be boring. The ovary makes 3 kinds of steroids. That's another name for hormone, all right? It makes estrogen, progesterone, and testosterone. There are other body sites that produce hormones. They're the liver, the skin, and the brain. So therefore, you have other places that are making hormones when your ovaries are just decreasing production. And by the way, the ovary never stops complete production of hormones. It's helped along by the adrenal. I mean, we were taught in medical school about the postmenopausal senescent ovary. You know, it's like it's gone and it's just useless and it's wrong. That's wrong. All right. Now, the first thing that happens is a decline in progesterone. Progesterone is the warming hormone that's high when you're pregnant, and it's very calming. It actually binds to the GABA receptors in your brain, same place as Valium. So when you have progesterone, you know, you feel like, you know, when you're pregnant, it's like kind of calm, maybe a little more anxiety about things, but calm, all right? So when that starts to decrease, the estrogen increases. Because sometimes you ovulate a couple times or whatever happens, the estrogen increases. And here's what happens. In the face of stress hormones like cortisol and epinephrine, then estrogen is metabolized into substances just like stress hormones called catechoestrogens. And those can increase these temporal headaches, that sort of thing. Testosterone either stays the same or it may increase, it may decrease. All right? Now, if the adrenals are weak, if you go into perimenopause or menopause with adrenals that have been beating out the stress hormones for the past 20 years, you're going to have a harder time making those hormonal shifts that make you go through menopause nicely, sailing through. It's also helpful if you've done some therapy and you've worked on that childhood trauma that comes up, all right? And that's helpful. People, in fact, who've gone through a catastrophic something in their 30s usually have gone through that and they don't have any problem with menopause because they already reinvented themselves. You know, maybe a chronic disease or a life-threatening disease, and they did it already, all right? These are the symptoms of progesterone deficiency and estrogen dominance. And this is what causes most menopausal symptoms, all right? PMS, premenstrual migraine headaches, where you don't have enough progesterone, irregular or excessively heavy periods, anxiety, nervousness, and there's this other symptom, crawling skin rashes, this feeling, all right? Now, let me tell you about the connection between the adrenals and the ovaries. Adrenals healthy, ovaries healthy, you can make the hormonal conversions, but too many women have adrenal exhaustion from too many stress hormones for too long a time, from worry, anxiety, awfulizing, catastrophizing, or what many women do, trying to control everything. Are you one of those people who has to get the dishes in the dishwasher just right? Or you can't go to bed at night? Or you got to wipe down that counter, get a Q-tip out, get everything in there, because you're desperately trying to control your environment when all that whatever stuff from the first half of your life is coming up. Give it up. Give it up, okay? Your hormones will be happy. All right. Too little sleep causes this problem. Nutrient deficiencies, protein deficiencies, B vitamin and magnesium deficiencies. So what do? Okay, first thing you do, increase fun and pleasure. Feel your feelings, follow the dietary recommendations I already told you about, get out in the sun a little bit, maybe take supplements like DHEA, avoid the news, that's one of my health plans, and think with your heart. When you think with your heart, this is really interesting, good research has been done on this. When you take a moment and think of something you love, and I want to give you some choices and see which one melts you, all right? Babies, like human babies, baby kittens, puppies, or baby birds, all right? I like baby bluebirds myself. All right, melting heart, baby birds. Some people, it has to be baby birds with no feathers whatsoever. All right? They need something that's really helpless, that they can identify with. When you think of this thing that you love, or a 2-year-old sleeping, anything where you go, oh, oh, and you hold that in your heart, you hold that feeling for just a little bit of time, it actually increases your DHEA. It increases your mother hormone from which every other hormone is made. Isn't that fascinating that you can change your hormone levels by changing your emotions? And the emotion you want is the emotion of appreciation, gratitude, and love. Changes your hormones. Wow. Okay? Now, who needs hormone replacement? Women who've gone through premature menopause, in their 30s. Women who've had hysterectomies premenopausally, and some other women who just are chronically ill. They might need some hormone replacement. Let me give you a brief history of hormone replacement. The Women's Health Initiative started in the early 1990s when we gynecologists were taught to give everybody hormone replacement like M&Ms. Because everyone needed it, because it was going to decrease your risk of heart disease, and if you didn't take it, you were a fool, and you couldn't come to our office. I mean, some guys were really like that about any women who thought, well, maybe I could go through it naturally. No, everyone needs hormone replacement. So they started this huge government-funded study, also partly funded by Wyeth Ahurst, the makers of Premarin and Prempro, which is a combination of pregnant mare's urine, made from the urine of pregnant horses, and Provera, which is a synthetic progesterone. All right, so that's what everyone was on. And then these women were on it for a long period of time. And then suddenly, in 2002, one arm of the Women's Health Initiative was stopped very suddenly because they found that, contrary to what they believed would happen, women actually increased their risk of stroke and heart attack and increased their risk of breast cancer on the Prempro. Suddenly, overnight, women were left high and dry, because some women did great on that. Let me be honest. Some women loved it and felt great. Others didn't feel so great. And one of the problems was they were using the same dose in everyone, whether you weighed 200 pounds or 100 pounds. So you'd see a 20-fold difference in blood levels in those two different groups of women. Now, reanalysis of the data shows that if you started the hormone replacement earlier than age 60, because most of the women in the Women's Health Initiative were older than 60, if you started earlier, then there may be a benefit to the heart. We don't know yet. Where we currently stand is that things are changing all the time. Remember when I told you at the beginning, one-size-fits-all medicine is obsolete, and you're going to have to use your gut, your inner guidance. But let me give you some of the benefits, the known benefits of hormone replacement for some women. Hot flash reduction, they're stars at this. Estrogen is a star at decreasing hot flashes. Some women feel better sexually on hormone replacement. Some women need just a little estrogen in the vagina for vaginal dryness. Some women feel better with their thinking and with depression. Shouldn't be given for that. If there's a definite increase in bone density on estrogen, and there may be a benefit for heart and blood vessels, we don't know at this point. The risks are breast cancer, uterine cancer, blood clots and stroke, pancreatitis, and gallstones. So what is the solution? The solution is, for some of you, what I call a dusting of hormones that match exactly those that are found in the female human body, not necessarily those that are for a female horse. I have a medical colleague who says Premarin is a natural hormone if your native food is hay.